Bueno, yo estoy cogiendo consejería. Ahora estoy en los programas de control de diabetes, que he aprendido un montón. Porque
the problems economically, socially, linguistically, all create barriers to our being efficient in delivering services. So we really need to constantly look for ways to bring the resources together.
HRSA, the federal government, can't do this inside the beltway of Washington, D.C. We need all of our partners. We need those of you in the audience to commit along with us your intelligence, your time, your resources, just as we're committing ours, in a real partnership with you, all for the purpose of improving the care that patients across the United States receive.
The collaborative is about a new way to do medication management, a new way to achieve patient-centered goals. So part of this collaborative model is getting people to come together and recognize that we do need to change. We need to change the way we look at those approaches and processes so we can do the right thing for the patient and get the outcome that we want.
Okay, Darlene, it was a 2.2 today. So have you been having any problems with the Coumadin, no bruising or bleeding or anything?
No. What is exciting to us is that we are raising the profile of the patient in the practice. It's not about us delivering a service to a population. It's about us working with the population to allow us all to move forward.
We don't have time to become redundant. We don't have time to repeat or try to relearn what we already know. What we have time to do is to take what we know from all of our partners, pull it together, and put it to good use for the patients that are seen in healthcare settings across this country.
Do you have an appointment today?
No, I don't. I was here last week and I had my...
We've learned that people do things right, they follow the process, so we get the patient registered, we get them in the room, we identify their medical problems, we write a prescription for them, the pharmacist fills the prescription, the patient takes it home, we find a way to get it reimbursed. Those are all things that we're doing that are right, but ultimately it doesn't work out. We find many times where the patient doesn't understand how to use the medicine. Maybe they're having trouble getting it filled, the adherence isn't there, or heaven forbid there's a side effect or an adverse outcome that we manage. So even though everyone's done things right along the way, we haven't done the right thing for the patient.
What's really important to move a facility forward with quality and to ensure patient safety is that you have all team members on board. Something that we learned from the very beginning is you have to have everybody together working as a team. That includes the patient, that includes support staff, that includes your pharmacists, your providers, everybody from patient advocate who speaks with the patient at the first encounter, right at the front desk, really needs to explain to the patient, you know, here we focus on quality and we focus on getting you better.
In your particular situation, you know, over the last 3 or 4 years being a dramatic improvement, you should be proud of yourself. Of course, I'm proud of you.
Thank you.
Results are so important in this quality improvement effort. The results are important at the local level, whether it's with 5 of their patients, 10 of their patients, or 200 of their patients. And then we're able to take those results from the local level and roll them up nationally to be able to tell our big picture story. On a national level, the collaborative has seen results in population health, in patient safety, and the capacity of our community teams to build integrated systems. And we've even seen our teams able to show the cost benefit to these services. They're able to bend that curve so that patients have more access.
The patient in the past, by not knowing enough about their medication, hasn't been able to play a role in the team. They've been an observer, almost, of their own healthcare system, their own healthcare services. with the education that we're providing to the patients, they now can pull up a seat at the table and participate in their care management. They understand why they're doing things, they're understanding what they're doing.
You feel that you're part of the decision-making process. And they know which meds you take and which meds you don't take, or which meds you like and they're fine, and which medicines you like to forget, you know, and they push a little bit when they get to that.
Typically, a lot of our patients have never had any primary care services at all. They've received all their primary care in the emergency room. So coming to a place where we're talking about meeting with a counselor, and meeting with a clinical pharmacist, meeting with a chiropractor, meeting with all of these services is completely new to them. We have to explain it. I mean, it's new to professionals. People aren't used to this level of services anywhere, let alone in a community health center.
The collaborative process has been good about teaching us the value of including other team members. And I think with the Pspc collaborative, we're talking about expanding that even beyond the health center. Other partners, colleges of pharmacy, medical schools, hospitals, other organizations, an expanded care team, mega expanded, way out to include everybody. That's the power, and that's the way to think about this.
Patient safety is important to HRSA, it's important to the President. It's really at the heart of care quality. And this particular collaborative then helps us focus like a laser, really, on the collaborative spirit that needs to be wrapped around improving care quality and also improving patient safety.
So many more people are realizing the benefit of integrating clinical pharmacy services into primary care. The momentum and traction by the community-based teams and the faculty is so strong that there's really no stopping where this effort's headed.